Good morning. Today is Saturday, March 25th, 2023. This is our regular virtual yoga therapy class, and first order of business is a sound check. Let me do a little sound check now to be sure we hear everything. Okay, sound check is perfect. So today is the first day of cherry blossom in Washington, D.C. The date for the pick was March 22nd to 25th. And today is the official opening of the weekend, but it is miserable outside. It is raining, it is a nasty day outside. Today was also National Kite Flying Day. In fact, it is in the tidal basin, just in front of Monument in Washington, D.C., and I think that also got postponed. So we have been presenting this year with all the yoga therapy for our chronic diseases based on our clinical experience. In fact, this is based on our experience. So many, hundreds and thousands of people have joined us. So last few weeks we talked about metabolic syndrome, which is obviously a number one killer for our society as a lifestyle related disorders, which includes truncal obesity, diabetes, hypertension, coronary artery disease like blockage in the coronary arteries, like called atherosclerosis, and dyslipidemia, high cholesterol, and also high triglyceride and low HDL. Today we'll talk about chronic low back pain. Excuse me. One of the most common ailment of the human being today in the United States, believe me or not, in the United States, 80% of the people have a chronic low back pain. If you don't have it, if you don't have the chronic low back pain, you are the, what should I say, you are the black sheep of the family. You don't belong to this family. Out of this 80%, about 8 to 10% has an acute, serious chronic low back pain, which is disable enough to prevent their daily activities, prevent their job, with an annual expense in the United States of almost over $100 billion. Unbelievable statistics. So let's start with what causes chronic low back pain, what are the remedy in yoga therapy. Chronic low back pain is primarily physiologically and pathologically is due to what we call a herniated disc or spinal stenosis, irritation of a nerve. Our vertebra, our spine, the vertebra, which we call vertebral body, was stacked one after another, and between the vertebral body there is a space with a little softer gelatinous material which carries your stress on the vertebra like a cushioning. And they're contained with like a fibrous rim. And when the fibrous rim has a little tear, there is a prolapse, or we call a herniation of that disc, and it irritates the nerve, and the nerve which is coming out of our spinal cord and going down to our lower extremities. Primarily it affects called sciatic nerve through our foramina when it comes down. So this is also called a sciatica. The pain is due to irritation of the nerve and then contraction of the muscles. Remember, all the pain fibers are in the muscles and the ligaments. Bones, cartilages, they don't have that much of a pain fiber. Most of the pain fibers are the ligaments and the muscle. The tightness of the muscles causes pain. In fact, when you feel, whenever acute back pain, you'll feel like there is a piece of brick sitting here. It is so tight that you won't be able to even move around. So if you go to a physician, you will know that this is such a serious pain. The pain medication doesn't work. Doesn't matter how strong the pain medication is, but it works as a muscle relaxant. When you give the muscle relaxant, the pain works. So a practice of yoga is nothing but a relaxation response. So in a relaxation response, you are relaxing all the muscles, so you are getting rid of the chronic low back pain. But what it is a daily practice, and it is your incorporating this yoga practice in your daily life. It is not like a pill. I'm going to take the pill and going to go away. It is a daily. And also there is a serious emotional component which causes back pain. It's a very funny story, and it's probably a real story. A daughter came and told her father, "Dad, I'm going to get married." Oh, Dad says, "Fine, beautiful." He congratulated his daughter. Suddenly, it hit him, oh, he's going to pay for the whole wedding. And that emotion of paying for the daughter's wedding started an acute exacerbation of his chronic low back pain. Many a time, and most of the time, you'll see you will not able to correlate what really caused the chronic low back pain. You will say, "Oh yes, I'm trying to pull something, I'm trying to twist, I was lifting up something." Yes, these are all, we will show you how to lift, how to bend, how to protect yourself for not to have the acute exacerbation. You will live with a very mild, low-grade chronic pain which you will be able to tolerate. Remember, in acute low back pain, it is a disaster. You cannot talk, you cannot sneeze, you cannot move, you cannot get up and down, you cannot sit down. I mean, it's a miserable condition, is an acute exacerbation of the chronic low back pain. Now, most of the time, from the yoga therapy standpoint, we do not recommend surgery. We do not recommend surgery for the pain, for chronic low back pain. Yes, you will need surgery when you are going to develop a motor weakness, like the nerve, instead of irritation, the nerve is getting compressed. The sciatic nerve is getting compressed, cauda equina getting compressed, spinal cord getting compressed. Definitely need a surgery and don't delay it. Signs of motor weakness, like a foot drop, weakness, and believe me or not, a back pain, given time, goes away. Even if you don't do anything, the acute back pain will go away and chronic back pain will stay. Very funny, interesting incidents I need to share with you. One of my friends who is a spine surgeon, who is an orthopedic spine surgeon, he was talking to the front desk. He said, listen, anybody who is calling for the back pain, give them the appointment right away. Because acute back pain is miserable. Acute back pain, the patient cannot live with it. And second, if you give them an appointment at a later date, his pain will go away and you are going to lose a patient. It was so interesting when I heard that. My personal experience is one of my friends who is a physician and developed even a motor weakness, developed a foot drop, saw the surgeon and is scheduled for surgery. Apparently, the operating room time was not available. He was scheduled for about 3 weeks down the line for surgery. By the time for the date for surgery came, his foot drop got better, pain got better. He became so well from his symptoms, he canceled the surgery. So, first and foremost thing, let's start with, before I go for the daily practice, what you can do for a acute exacerbation of the chronic low back pain. What does it mean? I have a chronic low back pain. I did something, I got an acute back, which is called acute back, and what should I do now? If you look at all the studies, if you go to the PubMed, look at the studies, even your established medical journals, like Annals of Internal Medicine, the Spine, you can name, the journals which our Western trained physician reads. There is an article about yoga for chronic low back pain quite often. Last one I think was last year on Annals of Internal Medicine. I have all this data with me. So let's start with, I woke up in the morning or middle of the day, whatever happened, I got acute back, which is term called acute back. What should I do? Cannot move, cannot turn, cannot talk, cannot sneeze. I'm in a miserable situation. Let's start relaxing your back. And then you touch your back is like a two-piece of rock. Okay. First thing you do, try to be, let me see if I can show you that. You want to be in the straight line with your spine, which you're not able to do because of the contraction of these muscles. So your approach will be, the first approach, to start having a relaxation of the back muscles. The therapy for chronic low back pain is to keep the spine straight. We call Merudanda Achal. So here I am having a very severe acute back pain. In a back pain, we do not recommend a forward bend. Forward bend exacerbates your chronic low back pain. In fact, therapy for chronic low back pain is the back bend on the mat. Why back bend on the mat? Because if you're unsupported back bend, unsupported forward bend increases the chronic low back pain. Also remember, in our whole spinal cord, we call it a thoracolumbar flow. That means the nerves which comes out from a thoracic, means chest, lumbar means your abdomen, this portion, they carry sympathetic nerve fibers. Called thoracodorsal flow is sympathetic, and the parasympathetic, which is a therapy for our chronic low back pain, is called a craniosacral outflow. Cranium means our head and neck area, and sacra means below the lower part of your spine. Those are parasympathetic. So, first, in a serious acute back pain, we recommend a supported forward bend. Put your feet together. That part you will be able to do. Now you support. Put your hand on a support. You can put it here. If you cannot, whatever height, you can even go to the kitchen countertop, or you can raise the table way high up, or you can go to the say bookshelf. Whatever height you are going to be comfortable discomfort. Remember, we are saying do not exceed your pain. So here it is, you're holding your hand and slowly bend your head down. Keep your spine straight. Try to keep a spine straight posture, and slowly, if you are able to come down, I'm going to show it to you so you'll be able to see it. If you're able to come down, you put your forehead and hang loose, and let's relax. If you can see it. Let me show it to you with the hands, another thing, because this is absolutely an important posture which you will practice. My spine is straight, my head is supported, my hands are hanging loose. Now I incorporate my breath. Pay attention to my breath. Breathe out first. I'm taking a slow, deep breath in. I'm breathing out longer than breathing in. Count of 2 in, count of 4 out. In a short time, you will feel that these tightness will start to melt. Here I am. My hands are hanging loose. My forehead is supported. I'm breathing out longer than breathing in. I'm in a wonderful state of relaxation. Then what you can do, slowly and slowly, you start going down more and more. Like say for example, now I have a lower part. So same way, I'm going to be my feet together, get my forehead down, my hands on both sides. If I can I can hang loose with my hands like this. But most important is, close your eyes, bring your focus to your breath, and breathing out longer than breathing in. Breathing out is your parasympathetic, and breathing in is your sympathetic. So breathing out longer than breathing in. So the therapy is Merudanda Achal and Manasthi, spine straight and mind quiets down. When the chattering of mind goes away, the acute pain slowly subsides. So progression from here, what you can do, you can, let me show it to you. Now you can do a supported forward bend. Like here, your feet are together. Look at how beautiful it is. Have your hand. This hand is your support. Don't do unsupported forward bend. Supported forward bend. Then slowly, it is not going to happen in one day, but it will happen with you. Slowly slide your hands down, but your back is still supported. You can go slowly going down. You can come down to your feet. You can come all the way down. Your hand on the ground. You can see it? Yes. Hand on the ground. Same phenomena. Eyes closed. Mind focus is in your breath, and body is going to drop it down. More and more it drops down. You put your hand on two sides now. Your knees are straight. Back is supported by the two hands on the sides. Continuing same phenomena. Eyes closed. Breathing out longer than breathing in. Effortlessly. What is effortlessly? What I'm doing. You can talk, you can sing. Slowly you can put your hands to the back. And bring your head slowly touching your knees. If you want to see from the side, so you will understand what I'm talking about. If you can go all the way down, your hands will be on the side, and the hands slowly will come down into the ground. Your knees will be straight, your hands are in the back. Generally, we put the hands on your ankle, and head slowly comes down, and it will touch your knee, and you continue your breathing. Generally, you will stay between 5 to 10 breaths. Next, this is your acute therapy for the daily maintenance for a chronic low back pain. Therapy is the supported back bend. Also, therapy is relaxation of your hip joints. You have a problem with your back pain is you have a pelvis. On the pelvis, you're stacking all the vertebra. So if you notice it, the problem is called the lumbosacral area. We call it the L5S1. Lumbar 4 and lumbar 5 vertebra, and that's the intervertebral disc in between. So the pelvis is fixed, and it is by two hip joints. Hip joints are relaxed. Your pelvis will also swing back and forth, and will adapt with the movement of your spine. There will be a lot less reaction and bending. So I'll show it to you, the other practices to correct your hip joint or relax your hip joint. In a standing pose, first thing when you get up in the morning, for a chronic low back pain, you recommend you sit down in a squatting pose. And I've shown you many times how to sit in a squatting pose and get up without a support. From here, you put both the feet together, bring a balance in your body, and then go close to your wall. Stand against a wall, touch the back of your heel, your hips, your back of your head, and slowly raise your hand up. Close your eyes. Same phenomena. Bring your awareness to your breath, breathing out longer than breathing in. You won't need much. Between 5 to 10 breaths, you will have a wonderful relaxation response. You can always put your hand over your head. This way will prevent much of your vata energy. More you move, your vata is your vata, pitta and kapha is your psychophysical body type. Vata is the movement energy, and it causes more pain. Same way, hands on your head, both the elbows touching back of your wall, eyes closed, breathing out longer than breathing in. We call this money back guarantee, because there is no therapy for chronic low back pain. It is miserable condition. So you practice daily. We all have. I was a surgeon, so I was operating like this. So I never paid attention to my back. So I had a very serious chronic low back pain, which I got over. Next, you do a little bit of spinal twisting. So first we call it a Tirjak Tadasana, oblique mountain pose. Get your hands high up, but another breath you have to hold into your arm and put both the forearm over your head. This is the way you reduce your vata energy and reduce your pain. Then slowly breathe out first. Take a deep breath in and slowly go to one side. And stay. Most important thing is able to stay. Eyes closed. Breathing out longer than breathing in. Count of 3 in, count of 6 out. Or count of 2 in, count of 4 out. For us, we've been doing it for so long, we can do count of 4 in, count of 6 in, count of 12 out. 5 to 10 breaths is good enough for your practice. Same way, breathe out first, a deep breath in, and go to the opposite side. This is your Tirjak Tadasana, oblique mountain pose. You notice both of my feet are together, my eyes are closed, my hands have been holding together over my head to reduce the vata energy, not to have too much of a pain, and able to stay in this posture. So see, when I touch the ground, we call it Padahastasana, hand touching the feet, we are all being supported. Same way, you will do a rotation of your lumbar area, which is called Kati Chakrasana. Very simplest to separating your feet, hands in the front, breathe out first, take a deep breath in and slowly turn your body all the way to the back. Then with the breathing out, same breathing cycle, bring your body in the front. Breathe in, breathe out. But you see, it's a very controlled, eyes closed, and you are following your breath. You can do same thing. Left hand goes to the back, right hand over your left shoulder. Breathe out first, take a deep breath in and slowly turn your body to the left side and look all the way to the back. Kati Chakrasana, waist rotation pose. Always coordinate with your breath. And effortless breath. Do not make any effort. Right hand to the back, left hand over right shoulder. Breathe out first. Take a deep breath in, turning to your right side, all the way to the back. And same breathing cycle. Come back also in the middle. We have also noticed the balancing postures, especially balancing with one foot and eyes closed also helps tremendously, because what it does, it quiets down your mind to the point that the emotional component of the back pain, like here, I'm right-handed, right-footed, I'm standing on my left foot. I'm standing on my left foot, that I close my eyes. See, it is sometimes very difficult to do it, but I'm standing on my left foot with my eyes closed. Same way, you do the right side. Eyes closed, standing on your right foot. Next you do a supported back bend. So standing up, if you're able to, slowly you can go back and touch the wall behind you. So let me tell you what I have done. I have come up 1, 2, 3. 3 steps ahead of me. That's a very nice way of doing the supported back bend, which we'll do more on when we are on the mat. Bhujangasana, Salabhasana. But here you can see the hand goes all the way to the back, but supported. It is not unsupported. I'm supported, I'm touching my hand, I'm going to the back. Slowly I push my body in the front. Eyes closed. Breathing out longer than breathing in. Continue between 5 to 10 breaths. Okay, now let's see what we do sitting down and laying down. Those are very, very important. What is happening here? Very important postures. Okay. For a chronic low back pain, if you're able to sit down in a squatting pose and get up without a support, it is the therapy for chronic low back pain and relaxation response. What is interesting about yoga therapy is that the whole practice of yoga is holistic. It is not reductionist. That means when I'm relaxing my upper part of the body, it is also relaxing the rest of my body. What a wonderful phenomenon. Suppose for the hands, hand get relaxed with, called Balo Mushti Mudra, like the baby fist, the way baby puts your thumb inside and close. So if you can do all the time, breathe in, breathe out. Any pain, any stiffness in your hand, do this. This is called Adhi Mudra, Bala Mushti Mudra. You can do it in the front also. Breathe out first, breathe in, and breathe out. Breathe in, breathe out. Wrist gets relaxed with the extension. Breathe in, breathe out. powerful relaxation which we recommend for you sitting in a chair, sitting everywhere, is a prayer pose to the back. Put your hand to the back. Go back so you'll be able to see the Paschim Namaskar. People said if you do only one asana like a Paschim Namaskar, hands here, keep your spine straight, slowly hands will go high up here, keep your eyes closed, do the breathing out longer than breathing in, and slowly hands will go high up. Longer and longer you stay, it will feel like your whole body is slowly just melting away. All the tightness are going away. You feel a sense of relaxation and your back pain is literally melting away. Hip joint relaxation, very important. Able to sit down is called your Baddha Konasana, closed angle pose. If you're sitting, always try to keep your spine straight. Doesn't matter where. You are in a chair, keep your spine straight. I have this kneeling stool which you have seen. I sit down in a kneeling stool but keep my spine straight. You're driving, keep your spine straight. So put your steering wheel as if you are holding it, you hold it in a 10 and 2 position and straight. So here also you go all the way to the back. All the way to the back. Keep your back supported. Put your feet together. And slowly bring it close to you. Back wants to come with me, but anyway, so when you are doing it, suit your closed angle pose, Baddha Konasana. Put your hands there, keep your spine straight, close your eyes, breathing out longer than breathing in. In a short time you'll see your knees will come down to the ground. You can move a little bit. This is called your Titli Asana or a butterfly. Hip relaxation asana. Extremely important for chronic low back pain. I can feel that both of my legs and knees are touching the ground. Able to stay in this posture. Spine straight. Baddha Konasana. Back pain is going to run away from you. Back pain will say, this is not the body I need to be in. Wonderful, wonderful asana. Laying down. A wonderful asana is your Viparit Karani Mudra. Viparit Karani basically means put your feet high up and touching the wall. Like you show it to you, you lay down first, slowly get your feet high up, and essentially you'll come to your posture. What would be the best one? Okay. I need to go a little bit closer, but because of this painting, when you have a solid wall, your whole hips and the heel will touch the wall because of this thickness anyway, but you understood the concept. Go all the way there, hands on both sides, palm facing high up, close your eyes. Viparit Karani Mudra. Then you do some asanas, first with your face up, then the face down, but all are spine manipulation. Now we are all talking about chiropractice, the manipulating spine. It's not manipulating spine. How do you keep your spine straight? So if you're laying down, let's see, what was your first concept? Was your hip relaxation. Okay, let's start with the hip relaxation. Same asana which you did on sitting down, Baddha Konasana. Now you do laying down, called Supta Baddha Konasana. So you'll be laying down. So when you lay down, remember that your chin is lower than your forehead. Don't have the chin way high up. If it is like that, put something under your head. See well, okay. Hands on both sides, palm facing high up, feet are together, eyes closed, breathing out longer than breathing in, and primarily your breathing will be your abdominal breathing, like the way the baby breathes. Breathing out, abdominal wall will go in, breathing in, abdominal wall will go higher. Then you bring the Supta Baddha Konasana, putting both the feet together. Bring your feet close to you, hands on both sides. Use the Adhi Mudra or Bala Mushti Mudra. Thumb inside and close your hand and close your eyes. Bring awareness to your breath, and we recommend for you to sleep in this posture initially, because that's where the baby sleeps. If you have a problem keeping the feet on this side, You can always use a couple of pillows or a folded blanket on both sides. We recommend a folded blanket because when the neuroplasticity sets in, the knees will start coming down slowly and you will be able to take the layers out. It's a wonderful relaxation technique and relaxation of your knee joints. Supta Baddha Konasana. Laying down, closed ankle pose. Keep your spine straight and keep your spine held. Hands on both sides, palm facing high up. Raise both the feet high up. Not all the way high up, 30 degree. Stay here, then get your body high up and get into your Naukasana, boat pose. And stay in the boat pose. You can see the little bit of a fasciculation. The boat pose, you can get into knee chest, Pavan Mukta Asana. So these are all, you can say, spine strengthening, but it is a forward bend, but this is supported forward bend. So when you're close to it, then you can go side to side. Right side, then you go to left side, roll on your side to side, then go front and back. Back pain, we'll think twice or maybe 3 times before staying in your body. Setu Bandha Asana, bridge pose. Feet are separated, shoulder width, hand touching the back of your heel. Clasp your hand and slowly keep going your body high up as the bridge pose. Every asana is done with your eyes closed. So in a group practice, you don't know who is doing what because it is not a competitive, yoga therapy is not competitive. It is your individual practice. From here, you can put your one foot high up, stabilize and balance. When you relax, remember, in yoga, all the relaxing asanas are called your strengthening asanas. Yoga practice is completely opposite of exercise. Exercise, you are contracting your muscles, you are tightening your muscles. It is sympathetic. Your heart rate goes high up, your respiratory rate goes high up, your blood pressure goes high up. And then it is a sympathetic overdrive that our body homeostasis brings the parasympathetic activation. So after exercise, we look at how fast your pulse rate comes down. And as you see all the time, we practice with our health tracker. This is your Apple Watch. If you want to do a little bit more of a spinal exercise or spinal practice in yoga, you can do shoulder stand. You can go high up. You will very easily do a shoulder stand. In a shoulder stand, when you relax, you can do a lotus Padmasana on a shoulder stand. From here, you can do a plow or a halasana. You didn't see it, this is, you go here, other feet will come down, and this is your lotus or the shoulder stand. All the way high up, go all the way down. And when you come down, always remember, when you're doing all these asanas, be sure your breath is effortless. Supta Pada Uttasana. Lay down, holding your toes with your hand. Back pain will run away from you. From here, you can do happy baby pose. Ananda Balasana. Ananda means happy, Balasana means baby pose. Go all the way down and then bring it back high up. And you will see the babies do it all the time. Ananda Balasana. Then we forward bend with the support, hold your knees, put your feet down in the ground. Same phenomena, eyes closed, breathing out longer than breathing in. Other spinal twist and other we call little spinal manipulation also is very effective and will end up showing asanas with your face down, which is called a back bend on the mat, which is the called a dhanantari. Dhanantari is the real therapy. It is seated forward bend. In a seated forward bend, you touch on your forehead. Remember, if you can, wherever you are, start where you are. You can hold your great toe, keep your spine straight, and keep coming down with your eyes closed and breathing out longer than breathing in. You'll be able to come to a posture without bending your knees, that you'll be able to clasp your hands and keep your knees straight. Same phenomena, eyes closed. Breathing out longer than breathing in. Head will come down and touch the knee. you feel like your knees are a little bent, but in fact it is not. When you do, you can feel the feet are touching the ground. Spinal twist. Your first, you sit down in a, we call it a Vaisasana. Vaisa means a buffalo or a cow pose. That's the way the cows or buffaloes sit down. One foot in the top of the other. Ardha Matsya Andrayanasana. Big name, but it's a name of a rishi or yogi, and it is a powerful asana for your called piriformis syndrome. Piriformis is the muscle on which the sciatic nerve is sitting, and when it comes out of the foramina, piriformis muscle gets into spasm, and it feels like a knife sitting here. Most of you have it already. If you don't have it, it is I don't know what is the biggest pain. People talks about liver pain. People talks about kidney stone pain. But when you experience a piriformis syndrome pain or another condition called SI joint, sacroiliac joint, the arthritis, inflammation, what it is, it's a traumatic inflammation. What does it mean? Suppose you got hit in the door jamb or in the car door, anything. So initially you will have a pain. Next day, you will have a redness, you have a swelling, you have a pain, you have a sign of inflammation. Calor, dolor, functionless. That means it is called traumatic inflammation. Put your right foot next to your left knee. Take your right knee towards your left side. Left arm will come outside your right knee. Right hand will go to the back. Left hand will come down, touch the knee, touch the ankle. Slowly, hand will go to the ankle. Look straight. Same thing. Eyes closed. Breathing out longer than breathing in. And slowly turn your body away from you. What a wonderful practice. Okay, opposite side. Always be balancing both sides, opposite side. All the asanas are done with your eyes closed, with no pain, with a breathing coordination, breathing out longer than breathing in, and with the effortless breathing. You'll be able to talk, you'll be able to breathe. Opposite side, Ardha Matsyendrayanasana. Opposite. Left foot close to your right knee. Left knee comes towards your right side. Right arm will come outside your left knee. Left hand goes to the back. Right hand comes, touches your knee, touches your ankle, same phenomena, eyes closed, breathing out longer than breathing in. Turn your body to the left. Remember one thing, anything you do your body which is an imbalance for your body and mind, it will affect your breath. Because it is a stress to your heart. Doesn't matter, it could be an increase in the intracranial pressure, could be an increase in the intraocular pressure. People say, I have a high intraocular pressure, I don't want to do anything of this. Do it slowly, do it gently, follow your breath. If you follow your breath, you are not going to hurt even if you have an increased intraocular pressure. It is a yogic concept called Annamaya Kosha to Pranamaya Kosha. Let's finish the session today with the therapy for the chronic low back pain, which is called your back bend on the mat. That means supported back bend. Think about it, all the herniated disc between the two vertebrae, if you're able to bend it back, it will open up the space, literally it will suck in that herniated disc. If you do a forward bend, you will squeeze more and more disc will come out. A relaxation, the most powerful relaxation is your Shakti Asana. I just got somebody shared with me, she said she had been sleeping all these years with her Shakti Asana and she didn't know it. So your face down, see how powerful asana is this. One hand in the top of the other hand. Forehead down and turn your face to the right side. Opposite side with the leg, make a 90-degree angle with your hips and 90-degree angle with your knee. Close your eyes, breathing out longer than breathing in, and this will be like your savasana on the face down. It is such a powerful relaxing asana, it is called a Shakti Asana. Did you get the idea? 90-degree on the hip, 90-degree on your knee, face turned to the opposite side. Same way, my face now turning to the left. Right hip 90-degree, right knee 90-degree, eyes closed, breathing out longer than breathing in. Back pain literally will melt away and will be gone. Markatasana, the best way to do Markatasana is what the children do, called TV viewing pose. Put your elbows together, hands together, looking at your television. And incorporate your feet, breathing in, breathe out. Markadasana. Bhujangasana. First, you try your Bhujangasana posture. Put your hands together, feet together, and slowly get your body high up and able to stay. It's not how high you go high up, how long you can stay. Slowly go high up, arms become straight, and you're able to stay here. This is your cobra pose, Bhujangasana. Next, you can test it with your hands on the sides and slowly getting up and able to stay here. This is a wonderful asana for your chronic low back pain. You also can do Tiryak Bhujangasana, feet separated. And remember one thing, we don't need any counter pose. We don't need any savasana, because every asana we do is a savasana. So wonderful relaxation response. Separate your feet up to the width of the mat. Get up into a Bhujangasana, cobra pose, and over the left shoulder, look into your right ankle. And slowly come down. Do the same thing, opposite side, over the right shoulder, look into the left ankle. This is the therapy for chronic low back pain. Back bends on the mat. If you're a teacher, if you're a practitioner, if you don't remember anything, two things to remember. For acute back pain, supported forward bend with the head supported and relaxing your whole body. The chronic low back pain is your back bends on the mat. Hands under your thigh, both the feet goes high up slowly and able to stay in this posture. Doesn't matter how high you go. Shalavasana, locust. Finally, Dhanurasana, the bow pose. All of our asanas are relaxing asanas. What a wonderful experience. A lot of other poses you can do, a lot of other asanas you can do. Cat pose, Madhyasana. So these are all your back bend. And then drop your spine down. See the measurement. Arm length separation of the knees and arm separation from the knees to your hand. Perfect tabletop. Drop your lumbar area down. Eyes closed. Breathe out first. Breathe in. Take a look way high up. Then breathe out and slowly get into your cat pose. In a yoga therapy, you stay in this pose. How long? Between 5 to 10 breaths. Last asana for the day today is your camel pose, Ustrasana. Hold, touch both of your ankles, push your body in the front and drop your head down. What a beautiful experience we have today. So, we are getting close to our time. It's a wonderful practice we have done. And next time we will get into pranayama for your chronic low back pain. So practice this. The asana for your health, well-being, and getting rid of chronic low back pain. Able to sit down in the ground, feet crossed, and able to get up from here without the support. Go straight higher. So, this is the end of our practice today. I don't know how much you guys feel. I feel wonderful. I feel the whole my back, instead of a 2 brick, now there is a 2 pillow sitting here. I'm comfortable. I'm healthy. I've avoided a epidural steroid, avoided a back surgery, but I'm constantly keeping my eyes on the motor weakness of my lower extremity. Motor weakness for the lower extremity. Do not wait if you have any sign of foot drop or motor weakness. Okay, see you tomorrow. I mean, not tomorrow, next Saturday. I hope I'm here next Saturday. Yes, I think so. Oh, next Saturday is April Fool Day. Wow, great. Okay, we'll talk about a pranayama and maybe also meditation practice for chronic low back pain. Okay, thank you for joining today.